Good evening, Dr. Uthappa.
Hi, good evening,
Hi.
Deepa.
How are you doing?
Great, thank you.
It's been a while since we caught up, and it's always been on my mind to really do this podcast with you because you're one person who shaped many youngsters. In fact, I started in India, with you, and the reason why I'm here today is probably because of you. I don't think it'll be easy for anybody who's starting new in India to sustain without the support of mentors like you.
Sure.
So I'm extremely grateful to you for that, and I would always remain grateful to you. Without wasting much time, I would go straight into the topic. You have been very inspiring to a lot of people, and I would like you to share your personal journey, especially with regards to IR, so
Sure,
that youngsters get inspired by your journey.
sure. I mean, due credit to you, it's people like you who make me, keep going that extra mile because feedback from people like you who really are, grateful and have the gratitude for what you've been mentored for. So I don't think, the best would come out of me. So thanks to you, and I'll also be very grateful to you always. And we've
Sure.
shared such a lovely journey in terms of shaping jointly many careers in interventional radiology. So coming to your specific question about my journey, so I basically got into medical school not by first choice. I actually did, I joined the NCC after my 12th standard,
Oh,
and then that got me into a medical school. And then once I started doing, we all did dissection in the first year. I enjoyed the dissection table, the anatomy, and that really motivated me that I probably can become a good doctor. And then obviously did my medical school in Mysore. Then to shape my career further, I've always with the influence that I need to be in a training program which will give me a complete training to become a good doctor. And some of my seniors advised me that going to the United Kingdom was a good option. So I did what many of us have done is do the PLAB exam,
yeah.
go to United Kingdom, and then the initial plan was to do orthopedic surgery. So I did my surgical training there and I got my FRCS. And then I was doing a 6 month job with two vascular surgeons. So with these Polish doctors, I used to work with them as the junior vascular
Yeah.
surgeon. And I learned how to do, a cut down. I learned to do how to do a fem distal. And vascular surgery was in the early days. We are talking of 97 time. And the vascular surgeons actually are really ones who motivated me to do this. So I would go to interventional radiologists with a request form
Okay.
for an angiogram, and sometimes they would do angioplasty. And I would see them do this, and I think, wow, this looks really good. Because I was comparing that to vascular surgery, and there we would have done a fem distal for like 2.5 hours. And
Hmm.
unfortunately, some patients
Yeah.
don't follow all the advice and they continue to smoke, and they would land up doing an amputation on them, and that would be really soul destroying. And then I got exposed to seeing an angiogram and an angioplasty, and I thought this really excites me. And then I took some more advice from great friends who were in the United Kingdom, and I then took up radiology, which is obviously a 5 year training program in the United Kingdom, with an interest to do only interventional radiology.
Hmm.
So, and then doing radiology training, learning all the core skills, because we all know, right?
Yeah.
To become a good interventional radiologist, you got to be a good
Good
radiologist. So
radiologist. Yeah.
that was the foundation. And then doing dedicated training program so I was in St. Mary's Hospital in London.
Yeah.
And then it was doing further training. I did my, fellowship in interventional radiology in Oxford. And then I became a consultant. And to be very frank, from the day I joined radiology, I never looked back, to become a good interventional radiologist. And then continued in the United Kingdom for about 5 years. And I thought I had done most things. And then I came home on my holidays. I would come once a year to India. And then there was, I'm one of those who once something gets into my brain and my heart, I'll be thinking about it. I'll have a sleepless night. And then I explored an option about thinking how would it be if I could do interventional radiology in India. So then I remember I come from Kodagu, which is not far from Mysore, and I went to Mysore, I went to Bangalore, and then I went to Manipal Hospital in Bangalore, which was
Oh.
the only really big hospital at that time. This is now we're going back to 2007. This was, and then I met the CEO, one gentleman, Mr. Basil, who was the CEO of Manipal Hospital, and and then he instantly actually convinced me that a talent like you would be, very meaningful.
Yeah.
And that feeling of coming back to the roots, I felt that the need that I would be able to, use all the knowledge and skill which I learned in the United Kingdom working in the
Yeah.
NHS, see if I could bring back to, to Bangalore, which is obviously home to me. And then that same evening, I remember telling Divya, my wife, that I would love to come to India. And luckily, she was very,
Wow.
very supportive instantly. Probably if she was not supportive,
I know you
it
would
wouldn't
have
have
been there.
happened, right?
Yeah. Yeah.
So, and then I took up a consultant radiology post in Manipal, and then I pursued the career. And then now it is 60, believe it or not, 16 years. And then I, like you, met many other colleagues, which I think we collectively been part of the journey of growing interventional radiology in Bangalore. And I think today, I know we are doing the 25th anniversary in Kochi,
Wow.
and we
Yes.
have come
Yeah.
a long way, all of us. So,
Yes.
yeah, that's been my journey in short.
Well, I mean, I can only thank your wife, Divya, for agreeing you to come here.
I think
Otherwise, I
she played a
think
part.
she definitely played a part because I think so many youngsters would have been deprived of your mentorship skills. And, we are what you are, we are what we are because of you. So I think, you were in the right place, the right time, shaping so many people. So thank heavens for that as well. And moving on further, did you have any challenges after coming to India? Because most of us, when I came to India, obviously it was a piece of cake for me because you were there and I didn't have to struggle much. But when you came to India, I'm sure, you would have your initial struggle. Did you have any difficulties to start with?
Yes,
Yeah.
it was a culture shock, right? When we go from India to any
Yeah. Yeah.
country, you get a culture shock. So there's
Yeah.
a reverse culture shock. I think the biggest challenge was I think I always was brought up to do radiology and interventional radiology.
Yeah.
So trying to do both in a corporate structure in India, I found it a little challenging because you would have to do all the diagnostic radiology part, and then you still have to pursue doing the interventional radiology. And I think people generally, doctors during, I'm talking going back to 2008,
Yeah.
people are not really aware that interventional radiology is not just a technical service, it is holistic management of the patient and whatever the problem they have. So I think that was difficult because to do diagnostic radiology and interventional radiology. The other big challenge was, yeah, you know, I'm glad that today we are not having a problem, but then
Yeah.
there was no systems in place
Huh.
in terms of how you engage with your colleagues, how do you engage with the patient, and then to make sure that all the material, the machine material is all available. So procuring that, yeah, basically, if I put it in one word, we didn't have a regulated system in place like we had in the United Kingdom, because the NHS was so well thought out, which has been there for decades.
Yeah.
So we could easily fit into a system and you follow a protocol. So there was lack of that systematic way of doing things. So that was a little challenging initially. But yeah, like I said, thank heaven that it kind of worked out by just perseverance and
Yes.
doing good work, keeping
Yeah.
the patient at the focus, right? Which is what we are always taught, right? Be patient centric. And I think whatever I learned in the UK, I just applied it and things just fell in place.
Yes,
Yeah.
yeah. And tell us more about your new setup. I'm sure you're very excited about the new project, and it's been two
Yeah.
months since you've been
Yes,
into it.
yes,
Yeah.
yes.
So how is it going, and what made you choose this particular project specifically?
Yeah, so I mean, to be very frank, it's not just my project, but yeah,
Yeah.
but I'm building the interventional radiology department in a hospital called Gleneagles Hospital in Bangalore. Um, so, so what made me want to do it is that I felt that interventional radiology, though we have worked with brilliant corporate hospitals in my 16 years, who have been very supportive in many ways, and we worked with great colleagues,
Yeah.
and we came a long way. But still, when I would approach the management for visibility of interventional
Huh.
radiology, I always felt we were shortchanged there, and I felt that if we have to reach out to the community at large,
Yeah.
we need an identity better than what it is. So that was one. The other thing was I was very aware of knowing that I was to tell juniors and colleagues that you should be having ownership of the patient. So, in a corporate structure, there is a system in place for engagement with patients. So, I felt that somewhere the interventional radiologists are not given the due credit for
Okay.
ownership of the patient. They're obviously collaborating and
Yeah.
doing, and many of the times we have to do that. So, I felt that if we have a standalone interventional radiology setup, it will give us the ownership where the younger generation will then take more control in handling the full care of the patient. And and when I mean full care, by being involved in what are the preventive measures that we could take to help that particular patient, and then obviously doing the procedure and the aftercare. So I felt this would be easy if it is a standalone setup to be able to do. So that was the second reason I felt. And last but not the least, I thought that interventional radiologists, like every other doctor in the healthcare
Yeah.
system, should understand all aspects of a procedure or a
Yeah.
surgery. For example, you have to be fully aware what all it takes to deliver a service in terms of what is the costing for, let's say, an infrastructure like an ultrasound or a CT or an interventional lab. What does it take for the consumables? What is the affordability of the patient? What does it take for the whole team to be paid for? And then obviously keeping all, when you do all this, not to lose focus that patient is at the
Yeah.
center, right? So that was very important. So I felt that a standalone interventional radiology department in a what I call as a boutique hospital will give us a chance to really execute that thought process I had in my mind.
Right.
Yeah.
Okay. And what are
There's
you?
something else you asked, right?
Yeah. What did I ask? I don't remember that. I think
I
that's
think
it. I
that
think
was it,
that
right?
was it.
What is
That
it
was it.
that,
Yeah. That
yeah.
was it. The other thing I wanted to ask you is, so when you start something new, I mean, we are all apprehensive about what's going to happen. You know, you have the fear of the unknown, about the sustainability of this particular project that you have taken up. What are your apprehensions, and what have you done to overcome those apprehensions and go ahead with this? Because there should be something to push us forward.
Yeah.
What was that which made you take that leap and do
Yeah.
whatever you're doing right now?
So, to be very frank, I'm a pathological optimist generally,
And a
right? So,
go-getter?
yeah, once I think about something, I think yeah, it's doable. But yeah, but having said that, the apprehension was that I was exploring an option from a very like a comfort zone that I had.
Yeah, yeah.
Heading
That's
a
right. Yeah,
department, heading a cluster of hospitals with a big team of doctors. The
correct.
apprehension was, when I go out there, will I be able to, will I miss that support structure? Uh, that was the biggest apprehension. The other thing was, how would patients and the doctors, colleagues with whom we work, how will they perceive, can this interventional radiology service be, delivered adequately compared to a big hospital setup? So that was the apprehension. And I was thinking how to overcome this. So what I did was a little bit of groundwork. So
Yeah,
one of the things I looked at, really, to be very frank, is the office-based lab system, setups. And also there has been a precedence of standalone IR clinics. And I knew some of the younger colleagues, to be very
yeah.
frank, and some of the other colleagues in the rest of India had already done some interventional radiology clinic setups. I knew there was a success from that. So I did some groundwork. And I think the biggest thing which I did, which I would be very happy to share here, is that I actually validated this project by, I won't name the individuals, but
Yeah.
I will just tell you that there were four large healthcare chains in India.
Wow.
So
Okay.
the people who really call the shots, the who's who of the healthcare in India, I proposed what was in my thought process to all of them, one by one. Uh, and all the four, who are themselves great doctors, pioneers, who've taken Indian healthcare to great heights, they validated the project.
Wow.
For
Okay.
example, one of them actually did tell me that we totally, totally support what you're doing, Dr. Uthappa. Where do you think we should set up the first project? It was that
Wow.
level of validation.
Wow.
So
Okay.
I suppose that came because they knew we had already done good work in interventional
Correct.
radiology.
Yeah.
So they felt that there's some truth in what this gentleman is saying, right?
Yes. Yes.
So that validation was probably nullified that little apprehension. Once the validation was there, then it is going through more of nitty gritties of how to set it up, what are the ingredients required for setting it up, and that's more detailing, which falls in place once you have a clear thought
Yeah.
that, we
Yeah.
got to go and get this done.
Yeah. How is the patient flow like? I mean, what are the strategies that you are implementing right
Correct.
now to bring in
Yeah, I
patients?
think this is a very important question, and I think to some extent, I'm also learning. But I think in the 2 month journey, what I decided was that I will approach each and every person that I can think of, be it doctors, be it technicians, be it nurses, even the marketing department people. I've really spoken to everybody in my network and contact, and basically tell them about this idea. And I'm glad to just share with you that everybody supported the cause, that if you're doing something like this, we would support it.
Wow.
So that was one thing. And then I also looked at the numbers in terms of what is the percentage of patients who would have, let's say, insurance. How many patients who actually reach out with their own out-of-pocket expenses?
Yeah.
I got that number, and then I felt, obviously, we also know, right? You and me know that when we work in big hospitals, many of the patients will come for consultation, but it doesn't convert to a
Correct.
procedure because
Yeah.
genuinely they can't afford that rate, right? And equally, some of these facilities are not available in tier 2, tier 3 cities and some of the government hospitals.
Correct. Yeah.
So I knew that the people who can't afford it, then I would be able to at least cater to them. And when you are setting up a standalone interventional setup, one of the things that each of us should aspire for is having control in the controlling the finances to some extent, so that you can help many more patients in terms of the non-insurance patients.
Yeah.
So, yeah, I think sort of mitigated our apprehension by thinking through and going into a depth of all these details. Yeah.
Yeah. The next question I wanted to ask. Okay. Um, you've actually mentored and shaped many careers. I mean, what do you think are the basic ingredients that a successful interventional radiologist should have from the beginning? Because you've had your own journey. I'm sure you've had your own lessons. What do you think that one should have as a basic ingredient to be successful?
Yeah. I think one obviously, some of them are very fundamental, right?
Yeah.
They have to obviously have done a good radiology program. I think
Yes.
that's a
Yeah.
core skill.
Yeah.
So that is something they all need to have. Then they also should have um, a likingness to patient engagement, because diagnostic radiology, there's no direct patient connect. So
Totally.
they need to have that patient connect,
Yes.
for which most of us became doctors, right? So
Yeah.
that should
Yeah.
still be
Yeah.
there in them.
Yeah.
Apart from that basic fundamental requirement, then they should be just very motivated in terms of making that commitment. Like we used to interview together, for some of the juniors who want to take
Yeah.
up in radiology. We would always ask them, what is it that really motivated them? So I would look out for those qualities in them. For example, they do believe that they can make a difference in the healthcare, delivery of service to patient, so that they believe they're going to make a difference. And whatever stories they have learned or experiences, they're able to share freely. So that means
Yeah.
what I'm looking for is really communication, right? They're able to communicate their feelings as honestly as possible. So that would be there. And then other thing I would probably would look out want them to have is being very open-minded and receptive to technologies that we have to adopt as interventional
Correct.
radiologists. So I think that is important. And last but not the least, I would want camaraderie. So for me, camaraderie is like
Yeah.
super important. So I would want to see, are they going to want to be part of big team? So I've used this phrase many times. If we say, do you want to have a large piece of a small pie or a small piece of a large pie?
Yes. Yeah.
So I will
Yeah.
somehow gauge, are they fitting that second category?
Ha,
To
ha.
some extent, I would want to see some of myself in them.
Yes. Okay.
So if I get that positive vibes and feeling with them, then I think, yeah. Then I know, right? I know, and probably you know as well, that if somebody has these qualities, you can nurture them and train them and make them equally able leaders in interventional radiology. So I think, yeah, broadly, I hope
I
I've
think, yeah,
covered.
beautifully put. I think I completely agree with you. And I think at the end of the day, it is to do with your mindset as well.
Correct,
It
correct.
is to have that mindset wherein sometimes it's a battle of egos, the challenges that we come across. And one
Yeah,
needs to have that mindset to
correct.
sustain,
Yeah,
the ego challenges that one faces in their career. And I think
correct,
that's equally
correct. Yeah.
important to really sustain and survive in this field. I mean, we all know that interventional radiology is kind of going to different people right now, different other
Correct.
specialities. Especially when you're starting something like this, like a standalone project. How do you think we can reach out to patients? How do you talk to the clinicians, or how do you get the patient referrals from them?
Correct.
Because they themselves can do these things. And
Yeah.
for example, nowadays ablations, a nephrologist can do an ablation, or
Okay.
anybody can do
True.
anything these days. So how do you deal with that, and how do you convince them?
Yeah. So I think, see, there are two aspects, right? One is if you're focusing on quality care for a patient in need, you would want the best for that person, right? So, so somewhere you will engage with people who are thinking alike. So one is to engage with people who will sync with you in delivering quality care for your patients. So that makes it easy to sync. Now, another aspect which you're bringing up, which is a very important thing to discuss all the time, is about turf war and somebody
Yes.
else doing it. To be very frank, I inherently don't ever bother about it.
Wow.
And I
Okay. Yeah.
tell juniors who always come
Yeah.
and discuss, sir, that person is also doing. I always tell them that you focus on what you have to do.
Yeah.
You focus on how you can do the best job, and you focus on being compassionate to that patient. So that if that is there, I don't think rest is all noise. All of this is noise. So you just sort of, but at the same time, don't bury your head in sand, right? You be aware of what's happening so that you can, for example, if you feel that a surgeon or another physician is able to do something, if you feel they're doing good work, you should have the ability in yourself to tell them, yes, they're also doing good work. But then you focus on what you need to do, and they will, India is such a huge country, and we have lots and lots of patient needs. And then you will also need to be aware of knowing that, just a simple example, right? Just to hammer this point down. Um, 2008, Dr. Indushekar, is we call him the father of interventional radiology for
Yeah.
Karnataka and Bangalore.
Yeah.
And in 2008, I was the second interventional radiologist. Broadly, there were others as well, but broadly, we both were there. And I remember one of our, passionate junior interventional radiologists who was actually in the USA now. And they were saying, sir, are we training enough? Too many juniors will we have? There's a fear and
Right.
about that. And I remember clearly saying, no, we are not training enough. And today, today again, we
Yeah.
can reflect on that same discussion. We need to train more, I feel, because there are so many patient needs. And I think we heard in the meeting we are in now, how young interventional radiologists have gone to tier two cities and really, opened up this Pandora's box for the demand for interventional radiologists.
True. Yeah.
So I think the turf war is, like I said, it's noise. So I would
It's
just
yeah.
say, focus on what you need
Yeah.
to do and just be good at it, get better at it. And another point which I wanted to bring up was inclusive. You become more inclusive. Now, for example, let's say it's a thought in my mind. Let's say I want to do breast intervention, and I think cryotherapy in breast, specifically one topic I want to convey the message, would become a big aspect in the future because it's
Yeah.
breast conserving,
Yeah.
it's non-invasive, it's a daycare procedure, and there are lots of aspects of in the breast diseases that we could actually help the patient. Now, if I want to set this up, I could go out on one limb, but I want to be inclusive. I would want to have a breast surgeon who thinks like me in helping patients and look at the big picture. So I would be inclusive to collaborate with the breast surgeon and then set up something which will then become standard of care. So like that, if you are inclusive in many areas,
Yes.
and we
Yeah.
interventional radiologists can do head to toe,
Yes.
and
Yeah.
we are probably so unique. We have the radiology skill, we have the compassion and patient connect. I don't think we should even remotely worry that are we the best person to do this.
Yes.
Clearly,
Yes.
we are the
Yeah.
best, but you have to make that inclusivity, collaborative effort
Correct.
should come out very frank and transparent. If that
Yeah.
happens, I don't think anybody can stop anybody.
Oh, that's a perfect mindset actually to really survive in this field, I suppose.
Correct.
I think collaboration and not compete is the key
Correct.
to
Yeah.
really succeed. And we often feel that we are competing with somebody, but if we can collaborate and feel included and also make them feel included, that's much better.
Yeah.
And the
Yeah.
second point, as you were speaking, which occurred to me, is focus on what you want. Don't focus on what you don't want. Quite often we end up focusing on what we don't want. We don't want them to kind of do IR. We don't want them to
Yes.
grab our
Yeah. Yeah.
specialty from us. We focus on all the
Like you said,
negative
yeah.
things.
Just
Yeah.
your
But
mind, the
just your
mindset part,
mindset,
right?
and
Yeah.
you just focus on on your skills. You do your best, and
Correct. Correct.
I think that's a fantastic piece of advice.
Perfect.
Now we are just coming to the end of it.
Sure.
So if I were to give you a time machine, and then if you were to go back in time, would you do anything differently, considering your journey so far?
I really can't. I don't think. In fact, it's good you asked me the question because it just sort of puts that thought process into perspective. That did I do the right thing?
Yeah.
I'm like totally convinced. I actually, to tell you frankly, I've not really met many interventional radiologists all over the world. I've had the benefit of going to many conferences, both from North America, Europe, Asia, and India,
Yeah.
which we are a big community now. And I've met many. I've not seen many people regret at all. They've had ups and downs. They've had challenges.
Yes.
They've had many other issues, but they all have come out really well.
Yes.
So I don't think, if I was given another chance, I'll probably pursue, at least in the medical field, I would like to pursue it being in interventional radiology. Why I say that is, I still feel, having done this for, roughly about, I would say, I became a proper interventional radiologist in 2000. So now it's what, 24 years I've been doing it. I still feel that there's so much to do.
Yeah.
So the fact that there's so much to do, I'm quite happy to learn and adapt new techniques, because even from the time I started, or from the time you started, you've seen
Yeah.
it's evolved in a big way.
Oh, yes.
So I think we've spoken about this in the past in different forums. For example, what can we get better at? For example, one would be, we have to do more patient awareness. We want to do more research-oriented stuff so that we bring some quality data from our cohort of patients, how we can get some funding for that. And then, of course, it doesn't stop from there. Even if we improve our services, getting feedback from patients, how we can get
Correct.
better. So I think if we do all of this, it's going to take me another 25 years, right? So I'd be quite happy to continue doing this,
Yeah.
even if the clock goes back.
Yeah. I think from the entire podcast, or from my questioning with you, you come across as a malignantly optimistic person, and I think I think it's very important for all of us.
True.
Rather than being pessimist, I think that's very important. And as you rightly said, I think communication is the key.
Yeah.
Because we are grateful for the fact that we did it in UK and then we came back to India. The communication skills are different. I know knowledge is different, but communication is different.
Yeah.
That's something that youngsters should focus on.
Yeah.
Communicate with patients, counsel patients, talk to them in a manner that they understand, communicate with the clinicians. I think it's very important, and
Correct.
you're absolutely great at it. So
No, thank you. But yeah, I agree with you totally on that.
yeah. So
I think if we can, I think it's your quote, and I use it very often. You've always said sharing is divine, and so you learn the skills and you're able to share with people. It just makes you, and the simple thing is, if somebody tells you Dr. DeepaShree is a great leader in her field, and so am I. I think we make more leaders. That itself will, percolate. It's like one is. I'm sorry. We set we set the bar high, and it is important to set the bar high, because then people will work that much more to get to that bar.
So true.
And then what happens? The whole aspect of interventional radiology gets so much, not glorified, but I think it'll then complete that. Community at the large will realize that actually interventional radiologists make a big difference.
Correct.
And so do other doctors. Not
Yes.
that they're, like I said, we're focusing on what we can
yes.
do, right?
Yeah. And I think reaching out to people through even digital media marketing these
Yes,
days, that
yes,
most
yes.
youngsters,
Yeah, yeah.
I mean, they started doing it, but the mid-generation level, we're probably
Yes.
not that
True,
tech
true,
savvy, and
true,
sometimes we
true.
don't do that.
Yeah, yeah.
And I think that's equally important
Very
these
true.
days.
Yeah,
Yeah,
it's
yeah,
important you mentioned that.
yeah,
Digital marketing, reaching out in as many ways as possible to the
yeah,
community at large is important because many of them are not aware.
absolutely,
And there,
yeah.
I have many anecdotal stories to share on that aspect. And even having done it for 16 years in India and Bangalore, I still feel there's so much to do.
Yeah,
And this is important that we both communicate to all the younger and IRs that they
absolutely,
all
yeah.
need to spend some time doing this.
Yeah, that's absolutely true. So the other thing I feel is, I mean, I was actually interviewing Dr. Gaurav Gangwani
Yes,
today, and he is one of these social media junkies or a
yes,
social
big
media
time.
person, big time into social media. And he was actually telling me, the different algorithms that the social media has, and the entire patient flow that he has is through his website.
Correct.
And he has like a whole PR team managing his social media
Very
sites,
professional.
and very professional. And I think that's something that everybody should be doing.
Sure, I
Yeah,
definitely would take a leaf out of his initiative.
yeah.
Definitely, I would also would want to learn from him on that aspect.
Yeah,
Yeah,
yeah. I think he
he,
does some social media workshops as well, is
very
what he
nice,
was
very
telling. So
nice.
maybe,
Glad to know. Yeah.
yeah. Finally, if we have to wrap up the whole thing with a little bit of advice to youngsters and to all of us for that matter, what is that advice that you would give? But people rarely follow that.
I think, yeah, I think you probably touched upon it. One is have a clear mindset, right? So I think clarity in thought, what you want to do for yourself and people around you. So that's, we say that first try and become a good human being, right? So I think that should always remain.
Yeah,
You want to be one is to be very aware of who you are, what you can do for you, your family, and your community. So being aware, being grounded, humble, all those things
yeah,
are very important. And then interventional radiology is part of that. But don't take the eye of the ball. You still have to be as best a person as you can be,
yeah.
and that will percolate into interventional radiology as well. So
Yes.
yeah, that would be my sort of take home message for people who are listening to this podcast or
Yeah.
video. Say that believe in yourself and just contribute to being a nice person around you. I
Yeah.
think that will help.
Absolutely. I mean, you're the third person who I'm talking to today, and every single person who I spoke to, every single successful person
Nice.
has spoken the same words,
Wow.
being grounded, being
Yeah.
humble. I
Correct.
think these are definitely two important things. No matter how high you fly, I think we should always stay grounded.
True.
And I think that will take us far. And it has taken you far, and you
Yeah.
are like one example for all of us. And it's been a pleasure talking to you.
Thank you.
And time flew. I don't know how many minutes we have done, but then it was an absolute pleasure and delight. Thank you so much
Thank you
for
so
being with
much,
me.
Deepa.
Thank you.
It was a pleasure. I enjoyed every bit of
Thank
it.
you.